coronavirus cases across the country are on the rise. It's raising a lot of questions. Nicole joins us now in the green room to help kind of separate fact from fiction. Nicole.
Yeah, the World Health Organization is all over separating the facts from fiction with regards to the coronavirus. And I think one of the most important questions to me, and one of the most interesting ones as well, is can products that are transported from overseas countries that are reporting cases of the coronavirus, can they transport the coronavirus here? The answer to that question is it is unlikely. The virus, as described by doctors, is a very heavy virus. It can stay on surfaces for hours, but the likelihood that it can survive the transport from an overseas country to the U.S. is unlikely. But of course, you can always wipe down those products with disinfectant and certainly wash your hands after receiving that product if that makes you feel more comfortable. And possibly one of the most important misconceptions to discuss is the coronavirus. Is it only infecting older people? That is not true. Anyone, and of any age as well, can contract the coronavirus. And of course, the older population with underlying medical conditions are more vulnerable, and those cases can become serious, even fatal, just as we've seen with those patients in Washington State. So, Russ, of course, you know there is no vaccine for the coronavirus right now, so patients are urged to seek medical attention if they show signs or, of course, if they're infected.
Absolutely. There's a lot to talk about when it comes to this, but let's talk about masks, because you see a lot of people with masks. People are buying masks. Where do we stand on that? Should we wear them? Should we not?
Well, in the U.S., experts are urging people not to rush out and buy masks. I spoke with Dallas County Judge Clay Jenkins last weekend, and he is pushing that same message because of the supply shortage for those who really need them, like those who are already sick or even in the medical profession. For a healthy person, experts say the mask can actually be a reservoir to hold the virus, and you could end up contaminating yourself simply by taking your mask off and on. As for other ways we can prevent the spread, the U.S. Environmental Protection Agency has released a list of products that are strong enough to keep you from those hard-to-kill viruses. They include a wide range of Clorox, Lysol, and Purell products, and of course, many others. But Russ, according to the CDC, a good old-fashioned hand washing with hot soap and water is still the way to go.
Yeah, just kind of what you would do during normal cold and flu season.
Absolutely.
So that's a good start. All right, Nicole, thanks so much.